Africa has contributed the least to the climate crisis, yet continues to be disproportionately affected by its consequences. So the continent is having to manage this impact in an already complex environment marked by conflict, disease outbreaks, economic pressures, food insecurity, and the urgent need to conserve biodiversity. The impact is deeply human. Women, children, smallholder farmers, pastoralist communities, and other vulnerable groups are already bearing the brunt.
Climate change is impacting every measurable health dimension. It is the human face of climate change. And one of the problems that we're seeing is that we see the climate space over here and we see the health space over here. Very much global health challenges that we've been supporting for decades and trying to address. But those global health challenges are also being worsened by the impacts of climate change. We're also seeing new challenges, like unexplained kidney disease. At the same time, the climate space is doing incredible work in mitigation, striving for net zero. But we also need these two spaces to speak to each other because climate change is directly impacting health. And unfortunately, while we're seeing these impacts worldwide, these impacts are felt differently, with some of the most vulnerable communities in the world also the most poorly equipped to meet these challenges.
When we work best, we bring a sense of humility to the work that we do. The key thing we try to do is tease apart what's in other people's minds to figure out what is the critical barrier that needs to be addressed. With the survey that was conducted that led us to the Grand Challenge that is being launched, this was done in a way that was participatory research, really tapping into the brains of people who are frontline healthcare workers and experiencing the impact of climate change on a day-to-day basis already. Someone was reflecting to me that in an era of AI where many things we can just type in and AI can give us an answer, the type of information that was unearthed through this survey is actually one that doesn't exist in the online written source of data that AI works off.
Grand Challenges Canada and Science for Africa Foundation partner with the Geneva Learning Foundation to design, implement, and analyze the Global Climate and Health Survey. It quickly turned into a very much large partnership where we started speaking to other partners and hearing that they were also very interested in asking what are the greatest impacts of climate change on health. So this partnership quickly grew to over 60 international implementation partners who helped us distribute the survey and reach it out to their networks to ensure we got as many people as possible. And we reached over 6,400 respondents from 107 low and middle income countries.
So we have seen many changes that are happening from a climate perspective that are related to health, the environmental factors that are making mosquito-borne diseases change because the vector itself has changed how it acts. So we're seeing more and more we need to think about malaria, we need to think about dengue, and we need to think about how the shift has actually impacted the communities we work in. Secondly, extreme heat has always been assumed as something that happens and that people have adapted to. But more and more we now know that the extreme heat that we're seeing as a result of climate change is impacting health of young people, older people, and even women who have been working and living in these areas. Lastly, the other point around climate we need to consider is the impact it has on an already strained hospital and health systems. People closest to this are often ignored. Health workers and health actors tend to work in extreme heat, in drought, and importantly, they also don't have access to data that would help them plan for epidemics, plan for rain, plan for supplies. So we need to see how health actors can have access to climate data for early warning systems and to understand actually what they may see when disease progression changes as a result of climate.
What is unique about innovation is that It's already happening. It's happening all over the world. Regardless of whether it's being supported or not, communities are having to figure out ways to adapt to the impacts of climate change. Nexa is here to find those innovations with the boldest ideas, with the potential for the biggest impact.
We're excited to be able to unleash innovators around the world who have new ideas to bring to bear, as well as innovators that have tested ideas and are looking to transition them to scale.
The design process for Nexa is exciting because it demonstrates what truly creative, transnational, cross-organization collaboration can look like in practice. In addition to building on locally guided priorities, the strength of Nexa lies in bringing together organizations that share a common commitment to locally led innovation and understand that complex climate and health challenges cannot be solved in isolation. So at the core, Nexa is about aligning global partners and deploying catalytic funding towards a shared goal. So the vision is to raise USD $50 million over 5 years to support transformative climate and health innovation. This approach is powerful because it helps avoid many of the usual pitfalls in science and innovation funding. What we have is fragmented impact when funders work separately, slower progress when each organization tests unproven models alone, and lack of buy-in when solutions are imported rather than homegrown. So I'm proud that Nexa's design has deliberately avoided these pitfalls, setting it on a strong path towards success. By bringing together organizations with complementary expertise, networks, and experience, Nexa can connect innovators to a broader ecosystem of support while ensuring that locally led priorities remain at the center of the work. So our hope is that this model becomes the default approach to funding science and innovation across Africa and beyond.
A very unique feature of Nexa, and something that we're very proud of, is the partnership. It's the fact that many partners have come together knowing that we all very much wanted to solve for the same thing. We all very much saw the impacts of climate change, and we very much want to support local communities in adapting to those impacts on health, on human health. And so we came together to build the program and to pool resources, financing, to support as many promising innovations as possible. What we've been hearing in this past year and a half is the need for that, the need to come together, the need to partner, the need to unlock financing. Nexa does exactly that. We're unlocking financing, we're pooling resources, we're learning from each other, we're building a robust program that will reach as many lives as possible.
Across the continent, researchers, innovators, and institutions are already developing solutions rooted in local realities and responsive to community needs. Through Nexa, we want to help move these innovations beyond promising ideas toward real impact by connecting innovators to funding, connecting them to partnerships, and connecting them to opportunities to scale. This investment also reflects our belief in the strength and potential of Africa's scientific and innovation ecosystem to generate solutions that matter not only for the continent, but for the world. We would like to call out with appreciation countries such as Rwanda, Malawi, Botswana, South Africa, and Senegal for their commitment to contribute to the Nexa Fund from the outset as we roll out this Climate and Health Nexa program. We are therefore immensely proud of the close to $2 million already committed by these 5 African countries and governments. We must shape policy at both country and institutional level, ensuring that our responses do not unintentionally worsen existing vulnerabilities, but instead strengthen preparedness, equity, and resilience. But we must build partnerships that bring the right actors together. So Nexa is a strong example of this. Convening funders, staff partners, innovators, policymakers, and implementers around a shared agenda for climate and health.
So we have now designed a program collectively with Grand Challenges Canada, which is trying to look at solutions that will help solve some of the problems the communities have told us that are impacted as a result of climate. These solutions, we hope, will be the ones that will help address this, and we hope that local innovators, entrepreneurs, and researchers will respond to this call and come up with big, bold ideas that will help address the needs we have.